Hi, my name is Stephanie McDowell. I am the Youth and Education Specialist at Paraquad. A Paraquad is a center for independent living. We work with individuals of all ages who have disabilities, helping them to live the best life they can out in their communities and being out in their communities and being just having through choice and opportunity, having that opportunity to do the things that they want to do. And that includes our children too, being able to have a voice and what they want. Children with disabilities are 3 to 4 times more likely to um, endure abuse and neglect in their lifetime. Especially children who are unable to speak or who need a lot of who need more physical care than who especially children who have behavioral disabilities such as ADHD, autism, things that an adult may find a little more challenging to deal with. Being a parent is hard enough, and then you have a child who maybe needs more support, and so that kind of leads to that, I believe.
Are there any other factors that would cause a child with a disability to be more vulnerable to child abuse and neglect?
Children with disabilities aren't often, they're not, they're not listened to, I don't think, as they're not taken as seriously. If they do say something, they're not taken as seriously. They're not as valued. A lot of times they're not as valued. A lot of times it is mostly children who have high physical needs, high physical care needs, who have behavioral problems, who are not able to communicate for one reason or another, whether it's hearing or whether it's not being able to verbally express what's going on. So a lot of times they are not only at higher risk for abuse, but that abuse tends to occur more harshly, more often, for longer period of time.
And let's talk about a little bit about access to services and supports.
Mhm.
Is there, in the child welfare system or other systems of supports that would provide support to children and families, is there lack of access or decreased access or difference of access?
I think that there is um, a difference in access. Not one size fits all. Being able to identify, for a safe adult to be able to identify, report that abuse. A person may not feel comfortable with that when it comes to a child with a disability because, well, maybe that's just how that family works, or they don't see it. Besides going to school or whatever, maybe they're not out in public as often. Maybe they're more at home. I know a lot of the children that I work with, they're not necessarily going to sleepovers and different things like that, just because of medical needs, high medical needs or behaviors. So they're not necessarily around as many people. And also the training. I feel like there could be more training for social service workers as far as how to handle families who have individuals with disabilities. They may not, how to communicate with that child, how to get that information from that child who maybe has a hard time communicating. So that can be a real challenge, just getting that information and knowing how to work with a child with a disability.
So if we're looking at the past several months, we have been in a time of stay-at-home orders and in social distancing, and we remain in that time.
Right.
So in your experience, or over the last several months, what impact has social distancing had on children with disabilities and their families? How might this impact their child's risk of child abuse and neglect?
It does increase the risk. I have had families, I've had families calling me, telling me that they don't know what to do. Usually the child's at school, the parents at work, the child is receiving their services at school, and all of a sudden the child's routine has changed. Whole family's routine has changed, and the parent is stressed out, don't know how to, don't know where to turn to get help. They're with their child 24/7 now. And so how do they deal with that? How do they cope? So just those coping strategies may not be there, or the old coping strategies may not necessarily work.
What steps can we take to protect kids with disabilities from abuse and neglect?
I think giving the parents the resources that they need is a big one. I've had parents, when their child turns 18, and usually by 18, a young person is more independent. But I've had parents who have children who have a child who has a more significant need for one reason or another. And at 18, the parent is just telling me, and I've had this happen a lot of times, the parent just is telling me, I'm just tired. I'm tired of, being mom or dad. And so giving those resources and strategies to cope with that, to help them learn to help their child to become more independent, or having the resources such as respite or something like that, they're not always having to be on, so to speak. So that's one way. Also, just for professionals, just being aware and knowing how to identify somebody who potentially is being abused or neglected, and how to talk to that person as a person with a disability. Like I said, communication, knowing how to communicate with them and knowing how to get that important information so that you can help them. Big thing is knowing the resources that are out there to help. A lot of parents feel alone. I think I've been working with Paraquad for 13 years. And I think that, a lot of the parents, they want to be good parents. They love their children. They just need those resources. This is something I'm passionate about and I really care about. So this was an opportunity for me to kind of express that.